I'm a suburban kid. I grew up outside of Philadelphia, about an hour and a half north of Philadelphia, in a fairly rural community, and went through public schools, local public high school. And when it came time to go to college, I went to Temple University in Philadelphia to study music. At that point in my life, I wasn't really interested or involved in politics. I was doing music, and that's mostly what I wanted to do. So I went off to Philadelphia, to the city, and started down the path of trying to be a classical musician. And after a couple of years of that, I kind of realized it wasn't the world I wanted to be in. I just didn't feel a part of it, and wasn't going to be a part of it, and kind of had to retool the way I was thinking. And so picked at that point, kind of 2 years into college, picked medicine almost out of a hat as something I thought I could get good at, but also in the context of my politics, kind of waking up and wanting to be involved in advocacy work. And I can step back a piece, because I think it's relevant to the kind of work I do now. As a young person, starting age 11 or 12, I was with my family. My grandfather is a Methodist minister, or was a Methodist minister. He's now retired and does other work. And he and my grandmother built an organization that's a lot like Habitat for Humanity. Every year they would raise money, identify a project in a community in Central America somewhere, and take volunteers down to make a start on the building, leave enough cash behind so that the building could be finished. And so from a very young age, that was vacation for us. Every year around Christmas time, the family would pack up and go to Mexico, Guatemala, Belize, Honduras, Nicaragua, Puerto Rico, work in poor communities, put up a building, kind of engage with the community for what it's worth for that short period of time, and then leave a concrete thing behind. And so my exposure to third world poverty and the inequalities of the world and of this hemisphere was actually pretty early in life. Through my teenage years, I wasn't so interested necessarily, and then after I realized I wasn't going to be a musician for the rest of my life, I moved off that path and kind of picked into medicine. Connecting the dots even further, after college, I finished with all my pre-med stuff, and decided to give a year or more of time just to be out of the country, learn a new language, learn a new place. And somebody invited me to go to Haiti, a place I'd never thought about, never been. And in 1996, I went down to Port-au-Prince to be a volunteer teacher. And 6 weeks turned into a year, turned into a year and a half of living in Port-au-Prince, teaching music with kids and adults. From Haiti, I moved back to the States and actually started volunteering with this organization called Partners in Health, which I still work with, and kind of came back to the States full of my own ideas about ways to be engaged as a health person, but having very little experience, and literally knocked on the door and asked if I could volunteer with them. So I started working with Partners in Health right after the Haiti experience in 1997, 98, and worked with them for almost 2 years before I started medical school in '99. So through medical school, I didn't do a ton, but I would skip out on class a couple times a year to go down to Haiti, mostly to do translation and other kind of work, since I really didn't have medical skills. But as I got into my third and fourth year of medical school, I was doing more and more on the ground, taking care of patients. And now that I'm a resident, I'm still in my third of 4 years of residency. I have exactly 6 months a year to work on Haiti issues. Almost every other month, I'm back and forth to Haiti, from a place where life expectancy is 75, 78 years to a place where it's 50. From a place where women rarely die in childbirth. In Haiti, 1 in 20 die of childbirth. From a place where there's essentially no malnutrition, although we do certainly have pockets of that kind of poverty here, to a place where everyone is malnourished, adults, children, and everybody in between. And so, you know, I'm making that trip to be a doctor, to take care of the patients that I take care of, to help the colleagues I have there to learn more and get better at what they do. And the boundary, the gap between here and there, rich and poor, just seems to be wider. I think most doctors in this world and most doctors in the poor world see their job as educated professionals or experts to meet a patient, make a diagnosis, prescribe a certain amount of therapy, and then their responsibility ends. And to me, that's just hardly the beginning of a problem. You know, if you've met somebody, diagnosed their problem, prescribed them a course of therapy, great, you know, pat on the back, you've done, you've done them a favor, but that's barely the beginning of them getting better. Sometimes the way to make them better is to build them a house. Sometimes the way to make them better is to get them out of an abusive relationship. Sometimes the way to get them better is to give them some seed money to do some work in the market and then become self-sustaining on that level. Sometimes the way to make them better is to give them seeds and let them plant when they haven't planted for 2 or 3 years. In a very real way, our focus is on medicine. We're a team of doctors, epidemiologists, nurses, and those things. And so what we do and where most of our money and time goes is into clinical medicine. But in Haiti, we run 8 different schools. We have about 3,000 kids in school every day. Those kids are fed every day. We provide jobs for, like I said, 2,500 people, so that has some stabilizing effect on the community. We have 60 water projects that are providing better water to the community. We have some sustainable agriculture projects in addition to reforestation and sort of environmental stabilization projects. We do some adult literacy, which is, I think, really wonderful work just in terms of building community and engaging people in their own environment. Partners in Health right now has significant projects in Peru focused on drug-resistant tuberculosis. We're actually moving somewhat away from that because the National Ministry of Health and the professional societies in Peru are taking over work that we started. We support several indigenous autonomous communities in Chiapas. Very different work. We don't have any clinics there because we've not been asked by the local community to build clinics. They just want our help with education, health promotion, that kind of stuff. We work in the former Soviet Union, mostly on a consulting and a kind of oversight basis, trying to deal with the drug-resistant TB epidemic in the prison system and how that's kind of overflowing into civil society. We have most recently and kind of most excitingly, something we haven't really touched on, 2 new hospitals in Rwanda based entirely on the model and the expertise that we've developed in Haiti. The Clinton Foundation, which has become one of the most articulate and most aggressive advocates for HIV in the world, asked Partners in Health to come into Rwanda to set up some projects to, one, take care of people, but also demonstrate that this model is adaptable to different settings. So as of a year ago, we have 2 new clinics that are up and running in Rwanda, based entirely on what we've learned in Haiti. And a lot of the teaching, actually, this is kind of an exciting piece of the collaboration, a lot of the teaching for the Rwandan nurses and doctors are Haitian staff. The colonial languages are the same. So the professionals in Haiti speak French. Professionals, although the local language is not French, the professionals in Rwanda speak French, and we've been able to send our nurses and doctors from Haiti to Rwanda to kind of help them get up and running. You know, the other thing that Partners in Health has been focused on in all of these projects is training other people to do the work. So that while I'm in Haiti, sure, I see patients, I see them as fast as I can and as diligently as I can, but more importantly, I'm helping a new generation of doctors there learn how to do HIV medicine, learn how to be advocates, learn how to stretch the boundaries of their training, and hopefully that's going to be a lasting gift to the place if we can just keep some of the local doctors in the country, give them a decent job so that they want to stay, and give them the tools to do their work.